if you come to me or Yvette with any kind of problem that you have, one thing that we'll do is we'll dig in to see where it originated. Don't let anybody discount your symptoms. Go make sure that you get somebody that is going to actually dig in and see where they came from. Because even blood pressure is a symptom. It is not something that originated and now it is something, a standalone condition that has to be treated by its own. It happened from somewhere. Can be an insulin resistance, and it can be a mineral deficiency. So there's multiple ways to look at this. It is just to have that somebody that is willing to go and drill down and see where it actually originated from. And once you fix the origin, the rest will fix itself. Are you suffering from a chronic disease? What if I tell you that there's a multitude of chronic diseases that actually have a single origin? And if we actually focus our treatment on the single origin of these diseases, that there is a chance that we might actually eradicate them. So Yvette, what do you think about that?
Well, today we're going blind. And the big reason is we decided to talk about something that has a multitude of avenues that we can go by and go down, because this topic is so prevalent in these days, because we constantly hear about chronic diseases. But I love the fact that what if we look and see maybe it's got a common denominator? So I really think it's a great way to look at it. And it's a question that a lot of people ask.
Yes, and I want to also start out by saying there's so many of these diseases where you go to the doctor, they classify you, oh, you've got high blood pressure or whatever the case may be. But your blood sugar readings is in range, but they don't test for the free insulin to see if there's any level of insulin resistance. And they just say, but now you have this high blood pressure, or you've got this peripheral neuropathy, what they call idiopathic, which is, I don't think that's always that true. Idiopathic means they don't know. So, and then they start focusing their treatment on that one system instead of going to look for where the origin really is. And I feel if you have a leak in your house, your roof leaks, you go into a room and there's this constant dripping from the roof. You're not only just going to plug up that hole, because it's not going to fix the problem. You want to go and see where is that leak. You're going to get into the attic. You're going to look where the pipe is that might be leaking, and you fix the pipe. That's
Well,
what you do.
you have a very good analogy there. And this brings me to the point of, I have experienced so many people that have gone for a doctor's visit and they come out of there and they're completely blown away because they're diabetic. It happened overnight. How shocking. And my thoughts about that has always been, no, this has come a long way. I remember a talk I once did, and it was about a study on the elevated blood sugars versus the insulin. And it was 13 years from when the insulin was raised that this person or the group of people were diagnosed as diabetics. So whenever somebody comes with this absolute shock and horrific, like, can you believe this? This happened overnight. No, it didn't. And this is where we really want to look at a little bit of telltale signs. So the things that are, like Johan said, the leaky roof that is treated, but maybe it's a broken pipe in the roof, or maybe there's a crack, or maybe something happened. So one of the things that really is very prominent is the fact that so many people have these peripheral neuropathies. Fingers aren't feeling, their feet are tingling, pain and discomfort, especially in the evening for some other bizarre reason. They get this, and they put it down to so many things. But Johan, explain to us a little bit more. That stuff starts long before you've even diagnosed it.
Yes. And we don't really know the exact mechanism, whether it is the actual sugar that's causing it or if it is the raised insulin. Because if you look at especially the peripheral neuropathies and also kidney damage, a lot of those damages, because peripheral neuropathy is mostly damage to the nerve endings. And if you if you go look at those damages start happening years before you have this elevated, constant elevated blood sugar. And now they say, oh, you've got diabetes. If it happens the other way around, diabetes first and then the neuropathy, then they will say, oh, you've got the neuropathy because of your diabetes. Both is true. Even sometimes when the neuropathy happens before the diabetes, that can already be an indication that your insulin might be too high. There's some form of insulin resistance, and that is what's causing the neuropathy. What do they call dementia nowadays?
Type 3 diabetes.
Type 3 diabetes. Why?
Mhm.
Because they found out that there is this problem with what they call energy metabolism in the brain that is caused by an insulin resistance in the brain. Now, I bear to say that that insulin resistance happens in the nerve endings of your foot and your fingers too. And that might be the start of that peripheral neuropathy in your hands or fingers or wherever it may be.
And it does show differently in different patients. We were just talking about what I was taught is the diabetic gait. Now, that is a typical way when people are walking and they're picking up their feet and they actually put them down. They have to mentally think of picking up your foot and putting it down. And I remember years ago when I was still working in the hospital, how I noticed that from our diabetic clinics. And that was long before we even looked into deeper the roots or the origins of that. And I was very familiar with that. So there's a lot of people that I'll sometimes have a look at them and go, oh, that guy's really got a diabetic gait. And then when you speak to them, oh, no, 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 I'm not diabetic. I'm not even close. But the sad part is, again, like we typically say, is, well, we can look at the origin before it gets to that point and maybe fix a few things. And we've spoken about how and what we would look at to fix, because it ultimately comes down to a handful of things, which is lifestyle and the food you eat. And do not discount lifestyle. That's really important. And we're not saying to go and exercise more. Please don't beat that one. That's not where it goes. But that's always been a very first observation. Or the fact I worked with a therapist once that said, I'm trying to think of an occupational therapist. And she was saying she noticed that when the people, when they do things with their hands and they can't feel on their fingertips, she would always ask them, are you diabetic? Oh, no. But those are telltale signs right in the beginning because it's the small capillaries. It's in the toes. It's in the fingers. So long before we've even put a name or a number or an ICD-10 code on it, there's already signs.
Yes, and here's the thing, that ICD-10 code rules everything because the doctor has to be able to put that code in his system in order to bill your insurance. And now, if we tell you, there's a chance that you might be diabetic, and now you go to the doctor and the doctor say, oh, Johanna and Yvette told me that I might be diabetic. So the doctor goes and says, well, let's test your A1C, which is a good test because it gives you an average of your blood glucose control over the past 3 months. And they might say it's anywhere between 5.6 and 6.4. And they would say, oh, that's perfectly normal. But what they don't test is your free insulin. And that free fasting insulin is usually a big sign to tell you, if the insulin is elevated, you're insulin resistant, or how they also call it nowadays is pre-diabetic. They're pre-pregnant.
And you and I have spoken about this so much. In the last couple of years, I'm talking 10, 15 years, The amount of information that has come out about insulin. If you and I go back to pharmacy school, when we learnt about insulin, it was very little knowledge. Insulin was the hormone that opens up the little gates and the glucose gets stored. That's what we learned. But subsequently, insulin is a very important hormone. It plays a role in our actual hormones, the estrogen, progesterone, testosterone. It plays a role in so many things. But as the years have progressed, we've learned more. So that's why I've always felt it's so important to know what is your fasting insulin. And there's no medication for that. So this is where it comes back to schooling and where we've been taught. And while there's nothing for it, so why are we going to check it? It's because it's going to take a whole change in your way you're thinking, in your stress control, in your sleeping. It's going to reset you back to eating the food God made in a most natural form. And that is what becomes far too big for the Western medicine system to handle.
You mentioned just something very important right now. We talked about insulin, the free fasting insulin, and then you also mentioned stress. What people don't realize, it's not only food that has an influence on your insulin levels. It's not only the food. Food is obviously a big one, but sometimes your stress levels have an even bigger and a more constant effect. Because stress is not in essence bad. If a lion is chasing you, you need to be stressed in order to get yourself out of the way. But work stress, money stress, family stress, those are low levels of stressors that just remains long term. If a lion is chasing you, you'll be stressed momentarily. You'll secrete the cortisol, you secrete the adrenaline at really high levels, and it'll make you jump over a fence so that you can get away from the lion. But money stress, work stress, family stress,
Health.
health is another one. It remains in the back of your head, and that elevated cortisol and adrenaline, it's not super high, but high enough to release some more sugar into your system constantly. That will raise your insulin constantly. That will make you insulin resistant in the end.
And when you and I have often experienced in our looking at a patient's history, most of the time, there's a tipping point. And something really can happen in a person's life that can affect your health far more than what people would think when it comes to a loved one dying, you being in a car accident or massive trauma. There are so many things that can happen, that can absolutely change your life. And when we look in the functional medicine realm and we go back and see where did something change? I mean, you get a lot of women that have very, very serious and stressful pregnancies. And after their pregnancy, everybody puts it down as, oh, she's got the baby blues. But what if you were overrunning and overruling some of your systems and you're not getting it back to where it should be? So it's really important to address these things and not wait till you get the diagnosis, but look at the telltale signs. I think we've spoken about this story before where we have a patient that went blind, lost his eyesight. And when I asked the patient, when were you diagnosed as diabetic, what's your blood sugar readings? Oh, no, I don't have any blood sugar readings. I immediately said, okay, we're going to do a blood sugar test right now. And it was 360. But again, that was, now I have a problem. But the months and the years leading on to my eyesight is going down. My fingers don't really feel. My feet are tingling. Those are the things we put down as normal. We put down as just getting older. No, you're not.
Yeah. No, because we get used to and we acclimatize ourselves to our symptoms. That little bit of backache, oh yeah, I know, it's my age. I just have to warm it up a bit. And you get so used to actually not feeling good that is now normal to you. That so many people already have some form of chronic disease, but they normalize it because it is just life. And I think if you, so many people, because they've normalized it, they don't know how it is to feel well anymore.
That is very true. Absolutely true. There are honestly so many people that have normalized the feeling of, or discounting it for saying it's the signs and symptoms of getting older.
Yes,
But what if you don't have to feel like that? What if you should be able to sleep good, wake up rested, have the energy to do things, not, you don't get up out of a chair in stages, but you actually get up and you move. And, when we talk about the golden years, I always love when they talk about the golden years, but something that's really become apparent to me, especially in America, most people in their golden years spend most of the time at doctor's visits. Now, how golden is that?
not golden at all. And I really do feel that once you start actually feeling well, you start listening to your body more. You start getting more sensitive to those signals of saying, maybe I need some more rest. Maybe I never need to eat that food product again because this is how I feel today. And what is really amazing to me, how people don't always connect the dots to your joints aching to what you've eaten the day before.
Uh-huh. True.
There's so many people who think my joints ache because I've done something. But what if you look back and you say, you did not do any strenuous exercise, but I did eat that Asian salad with 5,000 teaspoons of sugar in it. And then think about, okay, well, maybe that is what caused the inflammation. That's why I'm hurting.
Yeah.
And now, how am I going to get rid of it? We've also talked in the past how your brain is more sensitive to the insulin resistance and the inflammation. And we've started out with the peripheral neuropathies. What if our nerves in specific is more sensitive to that low levels of inflammation and low levels of insulin resistance than anywhere else in our body
Yeah.
before they even diagnose you as
Hmm.
insulin resistant?
And
You know,
you and I see a ton of podiatrist patients.
yeah,
And I remember seeing patients where, it honestly looks like they've got gangrene in their toes. And I would always ask, so what are your blood sugar numbers like? Oh, no, no, not have a problem with that. That would be my first alarm, would be, what is going on here? How come your toes hurt so much? How come it doesn't heal? So the profession of podiatry has really increased over the years. And again, that to me looks at the end result. So now the toes are hurting, the toenails aren't well, the toes aren't healing. But doesn't it lie a little bit deeper? Couldn't it possibly be from the system that is feeding through to that? And now you see the end result as my toes aren't healing. Also, the high incidence of toe funguses. It's huge. So the correlation there, a lot of that stuff have been recognized, but a lot not. So if you get the one thing under control, then other things seem to heal. So there's so much that we can look at with little signs and symptoms long before you even get labeled.
yeah. And at this point, I want to mention something which I feel is a major breakthrough.
Mm-hmm.
Finally, people started to wake up, is the renaming of PCOS, polycystic ovarian syndrome, as PMOS, polymetabolic ovarian syndrome. Now, that to me says finally somebody woke up and figured out there's something else going on. It is not just the cyst in the ovary, there is something causing those cysts. And many times it's a metabolic origin. So, and we've seen it both. We've seen people with PCOS, we fix their metabolism and the PCOS goes away. So that I feel personally that is a major breakthrough. And I think people really need to look at those symptoms. How about renaming peripheral neuropathy as metabolic neuropathy?
And with regards to the PCOS, what's really to me is, I'm very excited about the fact that they've taken the focus off the ovaries, everything with the uterus, everything with the female sex organs, and opened it up and shown us this is more than just this. Because if you look back, and I've never forget, I listened to a nutritionist once, and he said, it's incredible the amount of women that have hysterectomies due to these issues. But nothing really gets looked into much deeper. Now, if men would have to go through castrations because of some or other issue they have, let's just say with regards to BPH, then all of a sudden we'll do a whole lot more research. So it's not a sexist thing I'm trying to say here, but I am saying that so much have been camouflaged in let's remove that organ versus saying, okay, hang on, what's the bigger picture here? Why is this happening? And the age of the PCOS patients is getting younger and younger and younger.
Yeah.
And
And I
these
want,
girls are really struggling.
and I want, if you're a woman with all your equipment, I want to tell you now, if you go to a doctor and they say, classify you as PCOS, even endometriosis has some form of a metabolic component, and they say, oh, we have to take your uterus, get up and you say you're going to seek another opinion. Because I've had quite a few really young, early 30s customers who came, who went to the doctor, and within less than a week, these surgeries start happening faster and faster, and the uterus was gone. They got the hysterectomy within a week. So I beg of you, there's so many times where that surgery is totally unnecessary. I would seek another option before you do surgery, because once you've taken that uterus out, you can't put it back.
And none of us come with spare parts. None of us come with replacement parts. So once it's gone, it's gone. And it does lead to more problems later down the road, believe it or not. Your problem is not gone. Like when you talked about the roof that had a leak in it, if you only put a new roof on there, the leak is still there. So these signs and symptoms will come now in other places because you haven't addressed the issue that started that.
And functional medicine is also called root cause medicine. So if you come to me or Yvette with any kind of problem that you have, one thing that we'll do is we'll dig in to see where it originated. And I've always told, even right in the beginning of our functional medicine journey, I told my wife one day, I said, there's so many ways to be sick,
Mm-hmm.
but there's only one way to be healthy. And now we've discovered there's so many ways to have a chronic disease, and there is a specialist for each one of them. And how much does a specialist charge? $300 and up per visit.
And
And
that's
then
not
you
a
have,
very long visit.
no, and you have to come back over and over again for that visit. How about paying once off and get it taken care of for the rest of your life?
And I do believe that there's a great misconception amongst people. I was watching some documentary, and this doctor basically stated that a lot of the functional medicine doctors or practitioners, they're going to add a whole bunch of supplements to you. It is such a misconception because ultimately, I don't want anybody to have to supplement anything. I want you to be fully and wholly reliable on the food you eat to be your nutrients. But all of us come from a different background. Things could have happened in your life that caused different things versus other people. You could have been exposed to years and years and years of antibiotics versus another person who has always struggled with constipation. So there's not a one size fits all. But I don't believe that chucking a whole bunch of supplements for everybody the same is going to be the outcome. No, it's not. Because what if this disease that you are now classified is deep rooted in some or other situation, issue, psychological, your mindset about yourself? What if it's rooted in that? So that's where the difference comes in versus we're going to put everybody on A, B, C, and D supplements and they'll all be better. It doesn't work like that. And that is actually how the medical Western medicine world thinks. So everybody that has neuropathies, we put them on something to mask the pain and the symptoms and the feeling. But it doesn't work for everybody. So if you are that person that questions this and go, for so long, I've been living with this and I've put it down to maybe I stand the whole day at work, so my feet are tired. They shouldn't be. They shouldn't have that pain and discomfort and constant tingling in them. That's not normal. So I always just want to throw the bone out there that nobody is the same. Not everybody takes the same stuff. And should you be taking it forever and a day? Hopefully not. Hopefully certain things can get better. Others can be enhanced. But that's how you look at it from a big picture. You go all the way out and you look at it. You're not focusing on, oh, let me look at your toe.
Yeah, for sure. And that is what we do, because if somebody comes to us, I'm taking our example of the insulin resistance. There's no amount of supplements you can give somebody to fix the insulin resistance. There's nothing that it'll do. It'll make somebody some money, but other than that, there's going to be no benefit in you taking the supplements for insulin resistance. But if you're insulin resistant and you also don't sleep and your mind starts racing, maybe you should take some supplements at night.
But that's also a good comparison with the insulin that I find is alcohol. So for a person who's an alcoholic, by only giving them a supplement, is that really going to help? No, because you've got to take the causative effect away. Then you've got to start putting back what damage the alcohol has done. But only adding stuff to it, it doesn't work, because did you solve the problem? No, you didn't, because 9 out of 10 times we're looking at trauma, we're looking at brokenness. There's so much more that goes with that. And a supplement is not going to fix it, but restoring and getting the body to the normal metabolic functions and getting those levels to most normal as possible, that's what we're trying to work for. So it's really important that people become aware of all the little things that they've put down to it's part of my life. Those things could be telling a big story. Johan, one of the ones that really, really is incredible, I just thought about that, is the keratinitis, I think they call it, on the back of the arms, and also skin tags. We have one of our clients who their skin tags fell off completely once the sleep, the stress, the diet, the exercise, once that was changed. And absolutely amazed. Like, I woke up and these things were gone. Those are another little signs and symptoms. So be aware and ask questions about a thing that shouldn't be there.
For sure. And if there's one thing I want to drive home with this podcast, is if you have any of these symptoms, if you have the tingling in your fingers and your toes, if you have numbness, that might also be a sign of peripheral neuropathy. If you start having trouble seeing, there is a thing about the lens not being that flexible anymore. I'm not discounting that. But instead of getting your A1C tested, tell your doctor you want a free fasting insulin. That is something that we commonly do in our practice, and it actually tells you a lot about what's going on metabolically in your.
And science have progressed in a lot of ways in the natural realm that we all have. Also, there's other signs and symptoms, the ratio between the triglycerides and the HDL, looking at the sex globulin binding hormone. There's a lot of other things that are telling us more about what's going on way before you have any diagnosis. I like to call it labels because I don't like people being labeled, but way before you being labeled, there are quite a few telltale signs and symptoms. But probably one of the most, you don't even have to have a fasting insulin resistance, fasting insulin test done. If you start with I don't feel something in my toes, my feet hurt, I got the tingling, I can bet you're already down that road. Yes, those tests will help us. It'll show us where we're going. But to confirm what you are thinking is not in your head, but it is actually something metabolically, that's the way to go.
Definitely. Absolutely. Don't let anybody discount your symptoms. Go make sure that you get somebody that is going to actually dig in and see where they came from. Because even blood pressure is a symptom. It is not something that originated and now it is something, a standalone condition that has to be treated by its own. It happened from somewhere. Can be an insulin resistance, and it can be a mineral deficiency. So there's multiple things, ways to look at this. It is just to have that somebody that is willing to go and drill down and see where it actually originated from. And once you fix the origin, the rest will fix itself.
And this is what you and I always say is, if the Western medicine is doing such a great job, why are we refilling prescriptions every month?
Over and over and over and over again.
And it is heartbreaking to me when I have a patient that says, I've taken this for a year and I'm not feeling any better. And well, there are ways. We certainly have ways that we can look and help, but it's going to require some change. And that ultimately is what you and I have seen the difference in people. There are the ones that'll say, I'll do whatever it takes. And there are the ones that'll say, I'm quite comfortable continuing on this road. And that to me is very heartbreaking because everybody can feel better.
Yes,
Everybody can have better results. But ultimately, it is up to you. What is your mindset like?
100%. And are you going to take charge of your own health and get some education and training on how to do it? Or are you going to hand over the keys to your house to somebody else?
And I've said this many times, that keys to the house that you hand over, that owner, he's not going to go home at night and worry about your feet hurting.
No. What he is going to worry about is how much money he can make off of you. And I'm not bashing doctors, but that is how the system is rigged.
Only when you ask the question yourself. And this is something I probably sound like a broken record when I speak about this. When I deal with people in the Western medicine profession, the ones that are the most open to learning and the ones that have really thought out of the box are people who have experienced any kind of sickness and disease that none of their medical books made sense of, and they had to start questioning, why am I feeling like this? Why does the standard regime not work for me? And when you encounter your fellow medical workers that have gone through stuff like that, then we're talking about the same thing because they've questioned everything they've done, didn't work. Why not? And really, those are the people that you want to speak to, the ones that have gone through certain things, discovered, okay, hang on, the standard approach is not working. What do I need to do?
For sure. For sure. Well, Yvette, I think we've given our listeners some food for thought to listen and think about, not just treating the one system that is affected, but to go look deeper. And I want to leave this again. Go get your free fasting blood insulin tested.
And don't wait until the system is broken. Look at the telltale signs. Ask, is this anything that I can change? Is there anything related here? And never let anybody discount you and say, oh, that's normal. I do believe we have to honor any question a person has, whether it is brittle toenails to, I can't sleep. Those are all important. Really address them before we have a broken system.
For sure. Well, this was great. And if you want to talk to us about this, we always post our calendar links at the bottom of the show notes. So reach out. Don't be stuck. Don't treat a system that might be related to your metabolism without fixing the metabolism. And let's see if we can help you. Take care, everyone.
Thank you, Johan. Thanks, everybody. Take care.
Bye-bye. Views and opinions expressed on this podcast are our own and are intended for educational and informational purpose only. This podcast does not provide medical advice, diagnosis, or treatment. The information shared should not be used as a substitute for professional medical advice from your personal health care provider. Always consult your physician, pharmacist, or qualified health professional before making any changes to medications, supplements, or health regimens. We are also promoters of Neolife nutritionals, beauty, and household products, and this stems from our knowledge of their purity and the company's reputation to provide products of outstanding quality. While we may discuss our experiences in the retail pharmacy setting and share insights into functional medicine, our conversations reflect our professional perspectives and personal opinions, and not those of our employers, affiliated organizations, or licensing boards. By listening to From Pills to Purpose podcast, you acknowledge that you are responsible for your own health decisions and agree that the host and guests are not liable for any outcomes resulting from the use of the information discussed in this podcast.